Hello, good evening, everyone. Thank you for joining us once again. This is our second installment of our What's Up Doc series with FeM Surgery. I'm Dr Png Keng Siang. I'm a urologist at FeM Surgery. So today we will still be on prostate cancer. And before we start, shout out to Singapore Cancer Society. We are proud to collaborate with them to continue on these cancer awareness campaigns despite circuit breaker. A lot of activities cannot be carried out because of the circuit breaker, and we hope through these online sessions we can continue to maintain awareness of cancer, and I hope people step forward. So last week we've spoken about prostate cancer treatment, prevention. We had Mr. Tan TJ, a prostate cancer survivor, share his experience. Today we move along and we have two healthcare professionals. They are a dietitian and a physiotherapist. And not many people know that diet and physiotherapy are actually closely related to prostate cancer. So without further ado, I would like to welcome Mr. Derrick Ong, the lead dietitian at Eat Right, and he has a lot of experience on managing how cancer patients eat better. So let's welcome Mr. Derrick Ong. Hey, hi Derrick.
Hi.
Thank you for coming to our session today.
Thank you. Thanks, Dr. Png.
Yeah. So today we are talking about prostate cancer. So, but before that, maybe we can share with our audience, in general, is there any food or any kind of diet which may prevent cancer in general, or maybe may actually cause cancer in general?
Yeah. So, I mean, it sounds a bit blasé, but actually, we actually, advocate a healthy, balanced diet, that's high in antioxidants, fruits and vegetables, whole grains, and lean proteins. That's the basis of any healthy diet, and also helpful towards preventing cancer. Yeah. And then also, there are certain things to kind of take note of, like for instance, red meat, and particularly processed red meat. To kind of limit that. Red meat, we say probably maybe twice a week. It's probably fine, but try to keep it the lean and the non-processed, and especially the charring and grilling. Has been shown to be particularly it's not actually good for cancer. Yeah. So that's the general kind of guidance. With regards to diet for cancer. Yeah.
Okay. Yep. So with regards to charring and grilling and processed red meat, in layman's terms, what kind of foods are these actually, for example?
Yeah. Okay, so we've got the processed food, so things like your sausages, luncheon meat. Okay,
very nice.
Okay, nice to eat, and convenient, but not exactly the best lah. Okay, and then for like charring, some of you will know, when you do like barbecue, you see that black portion, right? Yeah,
the searing.
The searing, and particularly when it charges black. So that is particularly not good. Really not health promoting in terms of where cancer is concerned. Yeah.
Okay.
So that is really something to be mindful of. Not to say you can't take all these things at all, but you should be limiting. And red meat itself probably no more than probably twice a week.
What about healthy foods? Anything that we should stick to, eat more of?
Yep. Okay. Yeah. So there are definitely quite a number of different sort of food components. So I mentioned generally about fruits and vegetables, but specifically in terms of vegetables, we know that cruciferous vegetables, so things like your spinach and broccoli and cabbage, all these are particularly good in terms of preventing cancer and fighting cancer. Yeah. So that's really good. The other thing is also, and a lot of people, talk about this, is lycopene, which is an antioxidant. Yeah. So this is an antioxidant that's found in a number of the red and orange kinds of fruits and vegetables. Yeah. Okay. So now I think you can see up here, which is being flashed on screen right now. There's some references to different sort of foods that are good, as well as not so good for prostate cancer. The words are a bit small right now. And we'll give you the link a bit later.
Where can we find this? What brochure is this? What material is this?
So this is a diet and prostate cancer booklet produced by the Singapore Cancer Society. So it's really an excellent resource. Yeah. Okay. And so it's really it's really a great resource for people to kind of look at. Yeah.
All right. So we'll share the link for this brochure on our website and over here. And it's actually, it should be available on the Singapore Cancer Society website as well.
Yeah.
Okay. So next, maybe we should, so there's the link for the booklet. So please click on it. Feel free and take your time to read through it. It surely provides a lot of good tips on what to eat, what not to eat, especially for prostate cancer patients. Okay, so let's go back to prostate cancer. In particular, when I see my patients, they may be prostate cancer patients, they may be non-prostate cancer patients, but they have heard a lot of certain foods and supplements that they know are related to prostate. For example, turmeric, pomegranate, lycopenes, like you mentioned, even like saw palmetto. So these are the few things that many patients come to me and they show me their newspaper clippings. So can you give some advice on these things, and are they really related to prostate diseases in general?
Yeah. Okay, so maybe first of all, I'd like to address the thing about prostate-specific supplements. For instance, you mentioned saw palmetto, which is taken by a lot of patients with benign prostate hypertrophy, or BPH.
Yes, BPH.
Yeah, so it's probably good for that, but as to whether it helps for prostate cancer, that's another thing. Yeah. We are not so sure about that.
So it's more for BPH.
Yes, it's really more for BPH.
Yeah. So BPH is actually the non-cancer disease that affects many men. That's not cancer, it's prostate enlargement that results in urinary symptoms. Yeah, so a lot of men take saw palmetto for that.
Yeah.
What about the rest?
Yeah, so and then you mentioned things like turmeric, pomegranate, so they're all very high, high in antioxidants. So there is one quite popular supplement called POMI-T, which there was a clinical trial run on it a couple of years back, where they actually gave it to men with prostate cancer, and undergoing treatment, and then I found that actually it lowered the PSA levels. So it actually looked quite promising. As to whether it can be used as adjunctive treatment for prostate cancer, we're not so sure about that. But it definitely helps to reduce the PSA. I guess no harm, but then probably not something you just rely on to treat prostate cancer.
Yeah, a lot of my patients do take it. But they are obviously on a main treatment, be it surgery or radiotherapy or hormonal therapies, but they do not think that there's harm. And I think if there's no harm, it's okay to take it. And they are, after all, antioxidants, which is in general good for the body.
Yeah.
So any other advice that you would give for patients who are actually undergoing surgery, maybe be it before or after surgery? Any specific food or diet that you recommend?
Probably no specific diet, but we know, like, for instance, after surgery, the body needs a bit more protein for wound healing and recovery. Yeah. So if you stick to, again, the lean proteins, your eggs and lean protein and all, like chicken breast and all these, you should be fine. And so avoiding the processed meats and all the charred red meats. Probably that would actually help as well.
Okay, so protein for the healing.
Yes, yeah, and of course, we've got patients who are undergoing radiotherapy,
yes,
as well. So their protein needs definitely go up as well.
Okay. Yeah. Okay. So at this point of time, for our audience listening in, do drop in your questions, and we will try to answer them as and when, or maybe later on in the Q&A session. So thank you, TZ, for your question. What is PSA? So at this point of time, PSA stands for prostate specific antigen. It is a cancer marker for prostate cancer. So a lot of materials out there which talk about prostate cancer would definitely mention PSA. So patients with prostate cancer would have a higher PSA in the blood when the blood test is taken. Okay, so thank you, Derrick. At the moment, we will continue to wait for the question to come in, and we'll come back to you later.
Sure.
Yeah. So we'll share some of the other questions later. At the moment, let's go on to our next speaker. So we'll come back to you later, Derrick. Thank you.
No worries. Thanks.
So let's introduce our next guest speaker, Ms. Vernetta Wong. Vernetta is the lead physiotherapist of the Physio Studio Singapore, and she has a lot of experience also with managing prostate cancer patients. So let's welcome Vernetta.
Hi, Dr. Peng. Yeah, thanks for inviting me this evening to talk about, the complications that is relating to the prostatectomy. So for myself as a physiotherapy, my main role will be targeting on helping these patients with incontinence that is relating to after the surgery. Yes. So incontinence is the inability to control the urine, resulting in a leak. It is kind of a major problem affecting this group of patients because it actually has an array of issues such as causing skin irritations, urinary tract infection due to the use of diaper, and also the inability to actually empty their bladder properly. Yeah, and also it's inconvenient to move around using a diaper, and this actually causes a lot of low self-esteem and social distancing, which doesn't help it at this moment as well. Or maybe it helps, yeah. So, and also it can cause emotional issues, affecting anxiety, depression, which can actually cause more issues coming out from the surgery itself. So another problem that I'll be tackling is basically called strengthening, because the entry point of the surgery still goes from the tummy, which will actually affect some of the abdominal muscles when it's being cut through. So we need to understand how to actually work that muscles properly, because it actually has a major role in facilitating our pelvic floor muscle contraction. So looking at the diagram now, shows us specific structures that can actually help us with our continence, and all the structures could actually be damaged during the surgery itself. So particularly our external urethral sphincter, which is actually below the bladder, is in yellow. It's a ring-like structure, muscles that contracts involuntarily to prevent the leakage of urine from the bladder down to the urethra. And below it, just below the prostate, it's our pelvic floor muscles that connects from the front, the pubic bone, to our end of the spine. And this is the important muscles that I'll be actually touching on, because this is the muscles that we can train to alleviate and cure the incontinence. And you can see that it actually passes through the urethra and also our anus, which is the opening up to our rectum. Yeah, this is where I will be actually assessing the strength of the patient after, before and after the surgery. And yeah, so let's move on to looking at, how, what are the factors that can actually affect this group of patients in terms of the recovery from the incontinence. So I've mentioned the anatomical structure. So if, let's say, more structures that maintains the continence are being affected during the surgery, and of course the outcome will be actually poorer. And also the stage of the tumor will also affect how much the doctor could actually salvage the neurovascular bundle, which is in charge of innervating, providing signal to our muscles. And the type of surgical technique as well. And also, like, your prior to your surgery, you might do like a urodynamics measurement, which is a test that looks into the muscles function of the nerve and bladder. And radiotherapy is a main concern. So some radiotherapists actually advise patients to actually improve in their continence control before they could actually go for radiotherapy. Reason being because radiotherapy itself can actually irritate the bladder and the sphincter itself, and it actually causes the incontinence to be worsened. So for patients who is actually about 65 years and below, usually have better outcome, because of younger age, and their muscle control are usually better. So the last point, which is the International Prostate Symptom Score, which I will share the link. Yeah, it's actually a 7-scale. Feel free to actually test yourself out on how well is your urinary symptoms. Yeah, this will determine whether you actually turns out to be having better continence control after the surgery itself. So it's a 7-scale item. Okay, so it's a 7 item. So it actually looks at how well you empty your bladder, how frequent you go to the toilet, and whether you have a lot of stop and start. We call that the intermittency during the urination itself, and how urgent you are. Can you actually postpone the urination, or you actually need to go immediately once you feel it? And how strong is your stream? Is it weak or is it strong? And whether you need to really strain when you actually to begin a urination, and how many times you need to get up at night to go to the toilet. And this are being scored from 0 to 5, and having more scores than less actually gives us poorer prognosis. So the patients with higher score tend to have more incontinence per se. And and all in all, they also look into the quality of life, that this actually urinary symptoms will actually affect this patient. So this will actually, all these factors will affect our outcome from the surgery. So let's move on to the next slide. Yeah. So this is actually looking at how common incontinence is after the surgery. The first row of arrows shows us that after 6 months of the surgery, it can vary from 8 to 87% of people still having incontinence, which is a high percentage. And this was without physiotherapy. So as the time frame, carries on, at 1 year it reduced by half, and then 2 years time reduced by 10. So which means that it's still spontaneous improvement even without physio. But the time frame is really long for them to actually get better. And at 15 years, if nothing is being done, they have no physio, they might actually worsen after that. So with physiotherapy, when particularly pelvic floor muscles education is being taught, they actually see improvement within 3 months. Only 12% of them actually remain incontinent, so which means they actually regain continence in 88% of the patients. And in 1 year, almost like all of them actually have full recovery. Only 5% actually still have incontinence, as compared to people who did not go through the pelvic floor education.
Okay, so it's proven that physiotherapy does help after prostate cancer surgery. Yeah. So when patients are referred to you, Vernetta, what can he expect? Let's say he's referred to you before surgery for assessment, and then he goes for surgery. What can he expect?
So, well, for a patient during the pre-operation assessment, we are looking at finding the baseline of their continence, even before the surgery, because a lot of them, before they go for surgery, they might have some form of urinary symptoms, which is due to, could be a BPH for many years. So they might have some form of urge incontinence, which is like intense urge to urinate, and there's no ability to wait. So other than that, we will also administer what I have gone through, the International Prostate Symptoms Questionnaire, to find out what is their baseline, so that they actually have a mindset of where they stand. And that is very important, to have that kind of set their standards, to have that kind of expectation, that they are not, that they may not think that is really, a grave decision. Yeah. So apart from that, we will look into like other histories. So we will take like some history to see whether patient has got spinal conditions that could also affect the continence. Yeah. And also we will do some assessment to check the baseline muscle strength. All right. And this we will allow us to actually know that, patient could actually contract their muscles or not. Yeah. So after which, then they go for surgery, then they come back to us for post-operation. And usually, as for you, you will send the patient to me as soon as you think that the patient is fit. Like, after the catheter is being removed, usually about 2 weeks.
Yes.
Yeah. So after which, I will start off with like my pelvic floor muscle training. Yeah. Which is a program that I would see them for like 12 weeks at least, and every week it will be a 1 hour session. Yeah. So this time round, I will reassess their strength again to find out what is the baseline after the surgery, and then at the same time, I will teach them how to quantify the urine loss as an outcome measure for them to realize whether they improve or not. So with lesser urine loss being better after with time. So after actually, to correct myself, before the surgery, I would actually set an expectation and inform them that actually they might need to prepare some adult diaper, because incontinence is really quite inevitable. Yeah, especially in the beginning of just right after the surgery itself. And that's when we will come back to like, goal setting, and then go into like the pelvic floor muscle training phase. Yep, let's move on to how I will teach them how to do the pelvic floor muscles contraction. So pelvic floor muscle contraction, another name for it is called Kegel exercise. So what we are targeting is actually the pink color band that is at the bottom. It looks like a hammock. So when you actually contract, you actually try to lift it up as you squeeze from the bottom, lifting up, with no breath holding and no pulling in of the belly button, which means you shouldn't be using your tummy muscles to activate that. Neither should you be using your buttock muscles. So you should feel as though like you prevent yourself from passing wind, all right? Or you trying to hold the midstream of your urine, that kind of feeling, but not to really do that as a form of training. And the first phase usually will introduce like slow contraction. So patients will actually slowly contract and hold for 10 seconds, and before they release and for 10 seconds. Quick contractions is something which I will only introduce after they have gotten the slow contraction right. Yeah, so because it might be quite traumatizing in the beginning to perform that, because they have the surgery, the connections between the urethra to the bladder, and that could actually cause a lot of pressure in the wound itself. So other treatment involved, apart from like teaching them how to do pelvic floor contractions, if let's say, all right, for patients with like maybe very weak pelvic floor muscles of zero, no contraction at all, to very weak contraction of 2, all right, I will introduce electrical stimulation as we see in this slide. All right. So electrical stimulation actually helps to enhance the contraction of the pelvic floor muscles. So it will be actually administered through an anal probe. So it will go through via the anal the anal channel, and this will increase the electrical impulses until patient could actually feel a tingle kind of sensation. It should be strong, but not painful. And with this, it actually provides a sensory feedback to patient that, oh, this is the muscles that I'll be working on, and I'll have to squeeze on that. And when they do that, they will actually try to also incorporate the way that I've taught them how to do the pelvic floor muscles to hold and squeeze and lift instead of bearing down and pushing out. Yeah. So another effective treatment is biofeedback, as we can see in the next slide. Yeah. So biofeedback, as you can see, it contains like it has a screen on the machine itself. Yeah. So this is a handheld machine, which is really convenient. Patient could actually hold it. Of course, it's also connected to the probe. So once inserted, they actually look at the screen. So as they contract and squeeze, the graph goes up, and then as they relax, the graph goes down. So this actually raises confidence on correct activation. Patient can see it, they know that they actually are doing it right. So it also helps to quantify contractions. When they have a number to look at, they actually feel that they are doing something, they feel motivated, and they actually helps to bring on the right contraction as well. So these are the main activities they will do in the clinic. And apart from that, some advice I will give them is on good toilet habits, as we can see in the next slide. Yeah. So good toileting habits involve not just a good position. We also look into patients may tend to go to the toilet when their bladder is not full, and this may probably cause them to be unable to fill their bladder properly. Yeah. So if they don't fill the bladder properly, you don't really train the bladder muscles. So what we actually advise them is to be able to hold the bladder, all right, for as long as they can. Maybe after the second urge, then they go to the toilet, and this will slowly teach them and improve the bladder filling ability. Yeah. So looking at the diagram or the picture in this slide, this is actually a good toileting position for seated toilets. Yeah, I don't. This is actually lifting up with with their feet on the block, which brings their knee above the hip. So this actually straightens the passageway for the rectum, and so that you don't really need to strain, and then the stool could actually comes out more easily. I don't really encourage squatting, because after surgery you wouldn't want to strain the wound, and at the same time when you're squatting, you're actually putting more pressure down the pelvic floor muscles, which makes it even harder to train it up. Yeah. So and of all, as best as possible, not to strain. So, which means if you feel the urge to go to, for the big business, you make sure that, it should be only 5 minutes. You go in, finish, and you come out. Do not sit at the toilet bowl. Do not read your newspaper, or, because all this could actually strain on your pelvic floor muscles. And having said that, let's go into the topic on constipation. This is something which is really important to look into as well. So for constipation, I'm looking at, like, people with difficulty passing motion, more than 5 minutes, they need to sit and strain, and their feces are usually like in pellet form or even hard and hard to actually force it out. So a good stool should be smooth and kind of moist, and it should be in one piece, and there's no pellet at all. So how do you actually improve that? Is through like high fiber diet, and this could actually, high fiber diet could also help us with weight management, which actually reduces the stress on our pelvic floor muscles. And in order to if let's say even fiber diet doesn't help you, you could actually get fibro gel, or maybe lactulose from your doctor. Yeah. So in order for us to actually, because when you take high fiber diet, you actually need more water. So you could actually drink a good, 6 to 8 glasses, probably 8 glasses of water, which is about 2 liters of water a day. And that could include also soupy items. Yeah. If you do take soups more, maybe you can cut down on the amount that you drink. Yeah. So apart from that, also we try to reduce caffeine intake. Yeah, caffeine intake is not so much to prevent constipation, but rather it actually irritates the bladder. Yeah, so studies have shown that 1.5 cup of coffee doesn't actually cause much of a worsening of your incontinence in moderate incontinence patient. So this is a study done on women, but because it's really rare to do it on men, so this is based on a study that is done on women. Yeah. So let's move into exercise. So the previous chart shows that some of the factors can actually improve in our cancer related fatigue, anxiety, also physical functions. So which means you need to exercise, because exercise itself has shown that it can actually help to prevent at the lower down the risk factors relating to prostate cancers itself. Yeah. So I've shared a link which is you can actually look at the dosage of the exercises to improve in some of the factors, how exercise could influence. And based on that, we look into exercising 3 times a week, 30 minutes each time, moderate to vigorous intensity. So before we go into further discussion on deeper discussion on the aerobic exercises, let's talk about core strengthening. We could actually address some of the exercises that you really are interested in later on in the Q&A. So what is core strengthening? We are looking at 4 major muscles here. So these 4 major muscles form like a Coke can kind of 3-dimensional shape, with diaphragm on the top, multifidus at the back of your spine, deep towards the spine itself, and also the transverse abdominis in the front, which is a horizontal muscle. It's not your apex. So when it contracts, it actually forms a corset. And at the bottom is our pelvic floor muscles. So when all these muscles work together, it actually forms a close-packed 3-dimensional core stability for you. All right, so that is why I need to address how important it is for us to train our core, all right, in order to help with our pelvic floor muscles. So let's look into, let me show you a video, all right, on some of the exercises that I'll be demonstrating. Yeah, and this particular exercise, Pilates, helps with core strengthening. So this is pelvic tilt. All these exercises can be done like maybe say 2 weeks after the surgery itself, so long that the wound is on the external is healed. It's very gentle exercise. Look at how I actually stabilizes my pelvis as I move my hip. So with that, it indirectly actually works the deep core muscles. So as you feel that your stamina improve, you could actually add on resistant band in the exercises, or you could use weights as well. Yeah, but most importantly, in the first phase, after 2 weeks, are very gentle exercises. For straight leg raise, I would advise probably, after 4 weeks. So I will usually introduce this exercise after pelvic floor muscles is being taught, and they are actually supposed to work the Kegel, the pelvic floor muscles or the Kegel exercises while they are actually doing the exercises. So this is working on the hips as we stabilize our pelvis. Segmental bridges are great for your glutes and your spine itself as well. So it can be done, say about 6 weeks after the surgery itself, when the wound is supposed to be healed. Yeah, so it works the individual spinal segment, your multifidus, your at the back, your transverse abdominis in the front, and hundreds will probably come in at a later phase, about after 6 to 8 weeks time. So it works on the front core and with varying positions that you can progress as well. Okay. Yeah, so if you have further questions regarding the exercises, you can ask me, during the Q&A as well, and I will answer you later.
Thank you very much, Vernetta. So definitely, it looks like a patient has lots of things to do with you when he sees you before and after surgery. So after all that, are there any key takeaway messages for them?
Definitely. Let me summarize the most important points, all right, is to come for pre-op physiotherapy assessment, because it's really important that you learn how to contract the muscles before you go for the op. Before you lost the sensation, before you even because after the operation, it's really difficult to learn how to contract. So you need to build the motor memory first. And start physiotherapy as soon as possible after the surgery. So when the catheter is removed or when all the complications from the surgery is being solved. And most importantly, work on the pelvic floor muscles is the main key to regaining your continence. All other muscles will not work if you don't work your pelvic floor muscles. And then look into good diet, which helps to prevent cancer from relapse and also to prevent incontinence from worsening, and also learning the right toileting habits. And not forgetting to be active, work on the aerobics, resistance training, and also the core muscle strengthening to facilitate the pelvic floor muscle contraction.
Thank you very much. So that was a lot of information on physiotherapy for prostate cancer management. So we have some questions that have come in, and I think we'll try to engage these questions. So in the meantime, for all of you who are online with us, please feel free to ask any questions or comments that you may have, or even share experiences that you may have. So let's bring back Derrick. Hi, Derrick. Welcome back. Yeah. So we have some questions. I think Sim Hui asked, my father drinks a lot of coffee. Is it really good in terms of prostate health? So how does coffee affect prostate health, if it does at all?
Yeah, so coffee, we know it contains polyphenols, which are is a form of antioxidants.
Okay.
So it could possibly help, in terms of the cancer, yeah. But then again, if you're drinking too much, coffee and caffeine, then that can sort of lead to other issues as well. Some people are actually caffeine sensitive. Yeah, so I think it's a bit of a balance. It depends really on how much coffee really he's really taking. Yeah, so probably about 2 cups is
okay.
Is
2 cups a day.
Yeah,
most of us have about 1 in the morning and 1 in the afternoon. I think that should be enough for the day.
Yes, yeah.
Yeah. So Anthony asked something about redox signaling molecules. Do you have any experience with that?
Wow. Okay. Redox. I'm afraid not. Yeah, but I think this again, this is an area that I have to confess I don't. Yeah.
Okay. So sure. Yeah, it's probably a bit more in the experimental side.
Yeah, it's a bit more esoteric. Yeah.
Okay. So probably we will not recommend anything definite at this point of time.
Yes. Yeah.
Okay. Sylvia asked an interesting question. Consuming chicken or pork meat, will the hormones or antibiotics inside these meats affect cancer patients? Let's say cancer in general, may not be restricted to prostate cancer.
Yeah. Look, because I know there's been a lot of talk about the hormones are injected and all that, but the thing is that as long as the meats are sort of properly cooked and all, pretty much the hormones and all these are pretty much all destroyed. So they'll be inactivated. You see, so I don't think there's any great issue there.
So that's reassuring. So Gregory, thanks for joining us. So Gregory asked another question on diet. Why is it cooked tomatoes? Are cooked tomatoes good for prostate health? So maybe I think he's trying to ask, is there a difference between cooked tomatoes and raw tomatoes in the salads, for example?
Yes, yeah. So remember I was talking about lycopene earlier. Yeah. So, and we know tomatoes is one of the nice rich sources of lycopene. So what happens in lycopene is that when you cook the vegetable, it actually goes into a more bioavailable form. It's converted to more bioavailable, so it's more readily used by the body. So it's one of usually any sort of heat and cooking usually destroy the antioxidant, but in this case it actually makes it better. See, so this is one of the lycopene is one of those it's antioxidant which works a bit differently. So definitely cook your tomatoes. And then instead of having them raw, if you're after the lycopene.
Great. That's an interesting fact.
Yeah.
Okay, so let's move on to another question from Sim Hui. Does these exercises apply to women? I think she was referring to those pelvic floor exercises.
I think, let me address, the pelvic floor exercises is really applicable for the women as well. For women's health is mainly to do with after pregnancy or postnatal kind of care. As well. So with incontinence, also. Apart from that, the exercises, like the other exercises, like the core strengthening, is also suitable for probably anybody of any age. So long that they do not have other orthopedic conditions that affect their spine, anything that causes pain. Should they be unable to perform the exercise or not sure if they should perform the exercise, they should actually consult a professional, a doctor, their doctors, or probably to look for a physio like me as well.
Okay.
Yeah.
So that's great. So Tizania asked another similar question. So does a recovery after surgery differ for genders between men and women, or is it dependent on how much exercise they do?
When you're talking about post-surgery, prostate only applies to men. So, if it varies even between patients itself. So from 3 months to some of them really up to 1 year. So as you can, if you remember just now I shared on the incidence of incontinence that it can be easily 87% having incontinence at 3 months. And then down to 50%, down to 10% in 2 years. So it is widely variable, and there is, and it depends on the type of, like, the cancer the patient has as well. Yeah. Yeah.
Okay. All right. Thank you very much. Yeah. Yeah. So what stage would be the best time to see see the patients for physiotherapy? Should they see before or after treatment, or what?
They should see us before the treatment, like I mentioned, to improve in the motor memory of the muscles prior to the surgery, so that they grasp the idea on how to perform the exercises correctly. And after they come back to see us, most of the time, patient with pre-op assessment, they tend to be able to actually contract immediately. Great. And yeah, outcome is also better for them.
Yes. Okay. Thank you very much, Vernetta, and also thank you very much to Derrick. We really appreciate your presence with us and sharing your vast experience with our audience.
Thank you so much, Dr. Peng. Yes.
Thank you. Bye.
Bye.
Okay, that was very useful, and I hope all of you who have joined us enjoyed that session. So before we go, I would like to maybe share that we are coming to the end of our circuit breaker measures, as you have heard over the media, and we are happy to announce that all our clinic locations under FeM Surgery will be fully operational from 2nd of June onwards. And for those of you who still prefer to stay home, our teleconsults are also available at the same time. But do take your precautions when you come outdoors now, come out of your homes with the ending of the circuit breakers. We should all still stay vigilant during this period and do our part to keep the COVID virus at bay. So once again, thank you. I enjoyed hosting this visit. I hope this session. I hope you also enjoyed listening to us. So stay home and stay safe. Bye-bye.